upon them arrogance. It's here again, on the road. Tries a virgin hope, open air for the pain. Today the room is full of people. Today it is colorful solace. And it goes in the recipe, written slowly to be read clearly. The word is food of the actual patient, of the brother. In their face, hidden as always, they can see it now, remembering the harsh words of the teacher. If crying is the cure, they cry then. There will be no doubt, no fatigue. Suns are joined together, morning after morning. There won't be doubt anymore, no more fatigue. Suns are met morning after morning. They snatch every space from death, out of all conviction, the most human. In the end, they will know that all that was learned will be more than useful knowledge. Today, more than ever, life is a witness of how to sort the promise.
Colombian health workers protests against the government over lack of resources. Health authorities in Brazil begin mass testing for COVID-19 in Brasilia. And the governor of New York presents plans to gradually ease restrictions as the number of cases and deaths slowly drop. Hello, welcome to Telesur. I'm Carla Gonzalez and this is From the South. Colombian health workers are protesting against the government's failure to provide them with protective accessories needed in handling patients. The workers, who include doctors and nurses, are demanding the Colombian government to urgently provide them with biosecurity supplies to ensure safety from contracting the COVID-19. So far, 5 health workers have died in Colombia from the virus, and more than 160 have been infected. And there is increasing concern over the situation in the country's prisons, where at least 25 cases and 3 deaths have been confirmed.
A state of emergency declared on the prison system has yet to have any effect as protests by inmates continue.
In this jail, there's one worker who has been infected. We are highly concerned because our administration, in coordination with Valledupar Town Hall and the governorship of Cesar, have done nothing to mitigate the situation.
The first cases of COVID-19 were discovered in a Villavicencio jail in the Meta department. From then, the Picota, Bogota, and Florencia jails have also confirmed cases.
The decree by the government doesn't address the most elemental problem, which is death. They already confirmed deaths of prisoners. They are ignoring the reality of our prisons, like they are the reality of Colombian families.
Experts agree that the measures imposed by authorities came too late, and they do not address the demands of the prison system.
There were rumors and complaints of an infected prisoner in Villavicencio jail. This was made known over the social media. Then, on March 22, authorities decided to transfer prisoners to other jails without testing any of them. Today, we have 25 infected in Villavicencio jail and 3 dead, on top of other infections in other jails.
Authorities also announced a process to free prisoners or place them under house arrest, which could benefit 4,000 of them. It will take 2 to 3 months to be put into practice.
Health authorities in Brazil carried out the first trial run of mass testing for COVID-19 in Brasilia. The plan is to carry out 100,000 rapid tests until Friday, the equivalent of 3.3% of the population of Brasilia, in a city of 3 million people. This process takes just minutes and can be done without people exiting their cars.
We're going to start with 100,000 tests, which is around 5% of the population of the federal district, but we will test up to 15%. The idea is to do 450,000 tests, which give us a lot of security regarding any measure and any decision we intend to take over this period.
In addition to being from a risk area, I'm a senior. My wife works in the health sector. She works frequently. She is a nurse. There is a risk that she brings the virus home. We have a pregnant woman at home. We really need to be careful to avoid transmitting it to others.
Intensive care units across 3 Brazilian states are now operating at full capacity due to the coronavirus pandemic. Our correspondent, Brian Meir, has the details.
Last week, health authorities in Amazonas, which is the Brazilian state with the highest number of per capita coronavirus patients, announced that their ICU units in the public hospital system were overflowing. And from that point on, anyone who needed to get on to a respirator had to wait for someone either to recover from coronavirus or die, who was in the ICU ward. Now, 2 more Brazilian states have announced that they're in the same situation. Ceará and Pernambuco, which are 2 states in the impoverished Northeast, have both announced that their ICU wards are completely full due to the coronavirus outbreak. Now, Brazil has 26 states, plus the federal district of Brasilia, and each one has their own public health system. They have a lot of autonomy on how to use their resources that come from the federal government every year. But the fact of the matter is, although some states are doing much better, the numbers keep increasing. Last week in São Paulo, which is the state that's hardest hit in the total numbers of coronavirus patients, announced that their ICU wards were 70% full. And only a week has passed, and the number's already gone up to 80%.
That was Brian Meir from Brazil. Bermuda has a total of 98 confirmed COVID-19 cases after recording 12 new positives on Tuesday. Of the 12 new cases, 11 were reported with ages of all confirmed ranging from 18 to 91 years. Thus far, 38 patients have recovered from the viral illness, while 10 remain hospitalized. According to the government, 44 people are either at home or in quarantine. Meanwhile, the death toll remains at 5. We have more stories coming up. Don't go away. Welcome back. Panama City's Metro has started to implement thermal cameras in stations to detect possible COVID-19 cases. The infrared cameras are installed at the entrance of the city's metro system and near the turnstiles. Authorities in charge say this is one of the ways in which public transport will forever be different across the world. Panama at the moment has the most infections for any country in Central America.
It is a thermal camera that has real-time video so that the operator can identify people with high temperatures and quickly follow a protocol.
The pandemic will change the way we move, the way mass transport works. Mass transport will change. Taking temperatures is one of the important measures, coordinated through the national government and the health ministry.
The Mexican government has approved an amnesty law paving the way for the release of first-time non-violent offenders to lower the risk of coronavirus outbreaks in the country's prisons. The government says the bill could benefit about 2,600 inmates in the federal prison system. The bill would include those convicted of less serious offenses like non-violent robbery or small-scale drug possession, and if the culprit was poor, forced into the act, or if they had a disability. Inmates who are indigenous will also be freed if they weren't guaranteed a fully fair process. The bill also provides amnesty for those convicted of abortion. The Mexican government has also suspended all non-essential work activities until May 30 and asked people to stay at home, although it has not enforced a mandatory quarantine. As of Tuesday, Mexico reports over 8,700 COVID-19 cases and more than 700 deaths.
All non-essential work activities in the public, social, and private sectors are suspended. This allows the most efficient mechanism to move millions of people out of public space without the need to use public force.
And with social distancing measures in Mexico, people are choosing to buy their groceries in their neighborhood stores rather than big supermarkets. Let's take a look.
In Mexico, neighborhood stores have become the safer choice for most.
They come more often, they don't take too long, they leave quickly. This is the best for a small business like ours.
Known also as corner stores, during these weeks, they have become essential as most people avoid large supermarkets.
They take care of us quickly here. We don't like the supermarket because over there it's more likely to be infected.
They say it's safer because it's less likely to catch the virus here.
We know these people, so we feel safer in our own neighborhood.
It's estimated that in large cities, neighborhood stores supply close to 50% of a family's basic goods.
We are a basic sector of the economy. We offer necessary goods. Not everyone likes going to the supermarket. They feel safer here and are treated well. We know our customers and we like to treat them well.
They have remained open through thick and thin, be it during a hurricane, earthquake, drought, or even a pandemic. We can clearly see that despite the rise of supermarket chains and the arrival of many new competitors, neighborhood stores remain the most important distribution channel of basic goods for Mexico.
In other news, a second shipment of medical supplies from China arrived in Argentina on Monday. We have more in this report.
According to health authorities, part of this shipment are donations from the Chinese government, while the rest were bought for around $4 million.
This plane is carrying supplies by Health Ministry for around 260 million pesos. And as part of this, there's also a donation of rapid test kits, which will be used to combat the pandemic.
Minister Ginés González Garcia also announced the arrival of 200 Cuban doctors, an arrival being criticized by some in the opposition.
We consider all human resources to be critical. This is why we are working to improve our capacities. We are modifying some laws, working with education system so that we can activate doctors who've graduated but are still waiting for their degree, so that they can help us.
The Airbus 330-200 landed in Ezeiza with the medical supplies to test citizens and protect medical workers.
The South African government has unveiled a $26 billion relief package aimed at supporting the economy amid the COVID-19 pandemic.
We are announcing this evening a massive social and economic support package of 500 billion rand. Another significant area that requires massive additional expenditure is the relief of hunger and social distress in our communities across the country. We recognize that food distribution capacity of the government is not adequate to meet the huge need that has arisen since the start of the epidemic.
And now we turn to Guinea, where the parliament has elected President Alpha Conde as its head after months of widespread protests, which left at least 32 people dead. The vote comes after the country's contentious constitutional referendum and parliamentary election on March 22nd. Major opposition parties boycotted both polls, fearing that a planned change to the constitution was a ploy to allow Conde to extend his grip on power, as the new constitution extends the length of the term to 6 years. The president of Madagascar, Andry Rajoelina, has launched a herbal medicine which he claims is a remedy for the coronavirus. The herbal mixture known as COVID Organics has been made from local medicinal plants like Artemisia and is claimed to be able to prevent and cure patients with the virus. The remedy has been produced by the Malagasy Institute for Applied Research. However, the mixture has not been proven effective against COVID-19 by any published scientific studies. And the WHO has also urged citizens to be careful over claimed cures for COVID-19.
So today I think I'm convinced. I'm persuaded. In fact, history will prove us. But today there are already 2 cases that have been cured with the plus Tambovi CVO+. But we will see what happens next.
We're taking one last break. Stay with us. Thank you for joining us again. In the United States, the governor of New York presented guidelines on the state plans to gradually ease up on restrictions, as the total number of statewide hospitalizations has been slowly dropping, along with the daily death toll.
We operate as one state, but we also have to understand variations, and you do want to get this economy open as soon as possible. And if a situation is radically different in one part of the state than another part of the state, take that into consideration. And that's what we're going to be doing.
And the United States continues to be the country hardest hit by the pandemic. Our correspondent, Jorge Gestoso, has the latest on the situation there.
The increase of coronavirus is not stopping. We're talking about 750,000 of cases in the US and over 40,000 deaths. We're talking double the number since 1 week ago. And there is a lot of tension, a lot of arguments between governors and President Trump regarding the test kits. Now, President Trump is passing the responsibility to the governors. The governors said they cannot take it because the federal government is not providing them even with the elements in order to produce the test kits, and it's absolutely considered by the medical world essential in order to really decide when to open the economy. Most of the people are willing that do it in a very cautious way. We're talking about 2-to-1 according to Pew Hispanic and Pew Research Center poll that says that 66% of them say that it's too early to open the economy against 32% that is not too early. At the same time, the governors, for example, the one of Washington and the one of Virginia, are blaming President Trump to push to create violence in terms of pushing to create demonstrations in different cities of the country, asking to their local officials to open the economy, and those governors are saying that those protests are being organized by pro-Trump activists. So the situation is that very carefully the governments of different states are deciding how to release the opening of the economy. In some cases, beaches are being opened. In some cases, parks have been opened. And the issue is that until the country does not know exactly how many people have cases of coronavirus, it's extremely difficult to make a plan. And that's exactly what I say that President Trump is not doing. He's not proposing a plan, and therefore they're leaving the responsibility to the states in order, according to analysts, to skip the blame, and they could blame someone else. They have been blaming China, the OMS, the CDC, the Democrats, and now he's trying to pass the ball to the governors in order to say that if something is going wrong, it's going to be their responsibility, because the governors say that Donald Trump has been extremely slow in the response of this pandemic, and also very inefficient the way he did it. We get back to you now.
That was Jorge Gestoso, our correspondent in Washington. Let's turn now to France. Schools will gradually reopen beginning on May 11th, when the country's coronavirus lockdown is set to end. However, classes will be made up of smaller groups, up to 15 students each.
This would mean students returning from the week of May 11. Actually, it wouldn't be May 11 itself, since there will be a pre-entry of primary school teachers. But in the following days, we would bring in all the primary school classes. Then we would have a secondary education in week 2, namely the week beginning May 18, with the middle school, for which it would be the first and fourth-year students as well as the high school, and finally the vocational high school, for which we would start with industrial workshops.
The Spanish government has announced that from April 27th, children under the age of 14 with an accompanying adult will be allowed to go for food shopping, visit the pharmacy, or go to a doctor.
We are not relaxing containment measures, and it is the responsibility of adults to ensure that minors who go out on the streets effectively comply with these recommendations. These are children, and therefore it is up to us, adults, to ensure that they comply, that their behavior is as so that there are no unwanted consequences.
Italy has announced a new economic package of at least $54 billion. But the Prime Minister Giuseppe Conte said that he will not accept a downward compromise from EU leaders in addressing the economic impact of the pandemic.
The overall European response has not yet reached a satisfactory level, and that is why I will not be able to accept a downward compromise here. This is not a zero-sum negotiation. There will not be some winners and some losers. I am intimately convinced, when we talk about Europe, that we will either all win or we all lose. The government will very shortly be sending Parliament a further report containing a request for a deviation from the previous budgetary targets program for 2020, of well above the figure announced in March, a very substantial figure, not less than 50 billion euros, which will be added to the 25 billion euros already allocated for a total of not less than 75 billion euros.
Foreign nationals undergoing the 14-day isolation period in the city of Wuhan have commended health workers for the good service that they received. Those who went up into isolation upon entering China, as required under lockdown measurements, praised the local epidemic control personnel for their hard work and help. This comes a few days after allegations had circulated in media about Chinese homeowners who had been accused of mistreating foreigners.
And then as soon as I arrived at the hotel, it's a process. So if you can put it into, for me anyway, putting it into my head that this is a process and everyone here is to do a job, which is to ensure safety, then made me feel a little bit calmer. And all the staff are incredible. Nice, sweet, easy to handle people.
And they usually used to come to our doors. Are you okay? Are you feeling comfortable or something like that? Life was like that. The management used to talk with us online. How do you feel? Don't worry. After the 14 days, you'll be okay. This is for your health. And I really understand them. This is safe for me to stay inside.
About 800 doctors and nurses from several frontline hospitals across Vietnam will participate in a tuberculosis vaccine trial against COVID-19. The director of the Central Lung Hospital in Hanoi said his hospital has sought approval for a trial to find out if the tuberculosis vaccine could mitigate the level of lung damage in COVID-19 patients. This vaccine has already been tested on some patients and people who had come into close contact with them, but the results have not yet been studied. Vietnam has reported more than 200 positive cases of COVID-19, of which over 200 have recovered. The country has not reported any new cases for 5 days. With that, we end our news brief, but you can find these and more stories by checking our website, telesurenglish.net. And be sure to find us on social media. We're on Facebook, Twitter, and Instagram. For Telesur English, I'm Carla Gonzalez. Thank you for watching.